So I assume, I mean, you've been doing this for a good amount of time, and you seem to have I mean, ENT is a very good practice. Why did you try to seek out a better way of doing this?
Well, one is always seeking out better ways of doing stuff, right? A less invasive way is the better way. If you can find a way of doing things, reduce your complications and enhance the recovery of the patient, that's the goal, right? So we are always looking for tools which will help you do that. And the as you do more and more of the surgeries, you see more and more of the problems, right? So
Mm,
you then you are seeking these alternative treatments even with more vigor than you would if when you're starting out and enjoying just cutting it out. As you
right.
see more of these, you see more consequences.
Mm,
So yeah, I mean and there's no one size fits all kind of a situation, right? So there are patients where you, if you had an 18-year-old young woman come to you who's with a 4 centimeter nodule in the neck, and they're seeking help, and you say, oh, I'm going to go and remove this, it's just not feel right to, and you know it's a benign nodule, and you know you can they cannot live with it because of the fact that it's causing cosmetic compromise.
but it sure sounds like quite a medical consequence for a cosmetic, and it's not just cosmetic, but
Yeah.
it is kind of considered in health circles as a cosmetic fix, unless it's very pressure filled, I imagine. But still, and there's a whole sense of self that's part of this, especially for your younger patients. I can only imagine. No one wants to make a change that's going to affect their body for the next, we all hope, 60, 70 years if you're young enough.
Mhm, mhm, mhm.
So it seems like it's something that applies or would be worthy for both young and old.
Oh, definitely along the whole age spectrum, because the young, like we said, the all the things that we talked about in terms of what it requires to do a surgery, all the immediate consequences, and this thing. And then the most important one, I think, is if you remove how somebody's half the thyroid, there's at least a 1 in 4 chance that they would require thyroid replacement for the rest of their life. Okay, so you imagine if you're like you have 60, 70, 80 years to live, and then
Right, you're going to be taking
you're having
medicine
to
that
take that
long.
medication for the rest of your life. You
Mm-hmm.
got to monitor the levels. You got to every 6 months to every year have a blood test and make sure that you're getting adequate. If not, then you got to tune that up. So it is a major lifestyle change, and if you can find an alternative way of preserving that thyroid, um, then you want to achieve that. In fact,
Mm.
if you think about the progression, the we used to do much more aggressively remove more aggressive surgeries of removing the entire gland, and then we went down to being more conservative, and even for small cancers, just removing one gland to preserve that function of the thyroid and reduce the complication. And if we can find another way, another technique which will even do that further, that goes on to the next step of reducing not just the complications, but this the preserving the thyroid gland, which is I think the theme should be for the next decade for us all, as to how much we can do to preserve the thyroid gland.
Interesting, yeah.